All right, let's take you to this now. The National Health Department says it has observed a slight increase in new COVID-19 infections as a result of less severe Omicron subvariants. The department says they are monitoring new infections in various provinces, including Gauteng, Limpopo and the Eastern Cape. Now, let's discuss this further. We are joined via Zoom by Professor Cheryl Cohen, Head of the Center for Respiratory Diseases and Meningitis at the National Institute for Communicable Diseases. Prof, thank you so much for your time this afternoon. Now, we know of at least 3 provinces that the Department of Health is monitoring, where the COVID-19 infections have picked up. Talk to us about what you are observing.
So good afternoon, and thanks for having me on the show. As you reported in your brief insert, we are observing an increase in COVID-19 cases over recent weeks. And so we think that there is an increase in circulation of COVID. What's important to mention, though, is that the environment in terms of COVID testing has really changed from what it used to be some months ago, in that the number of people who are coming forward for a COVID test are much, much less than they were before. And of course, there's reasons for this. We don't have, quarantine and all of those other strict controls. And so many people, you don't feel that strong urgency to know the diagnosis. And what that does is it makes it a bit more difficult for us to compare what's happening now to previous waves, because a lot less people are testing. So the one indicator that's really very reliable, though, is the percentage of people who test positive. So of everyone who comes to test, what percent of people actually get a positive test? And this indicator is really increasing, and it has been increasing, in fact, for a number of weeks. And in fact, so that one has been increasing for several weeks, and now the case numbers were slower to start going up, but they also are increasing. And the increases in percent positive is really in all the 9 provinces of South Africa. So there is quite a lot of COVID around. There is COVID circulating. But what's really important to note is that while we are seeing an increase in cases, and we are seeing this increase in many different provinces, we're not seeing an increase in hospitalizations. So it's not translating into the hospitals being full of people who are sick with COVID.
I suppose that's also very important.
The reason...
Continue,
yes, absolutely. And the reason for this is that many people have immunity, right? So most people in South Africa have had infection or have had a vaccine. And so the COVID virus is behaving quite differently to the way it did in earlier waves, because we have a lot of immunity in our population. I just want to highlight one point, though, is that just because we're not seeing lots of hospitalizations doesn't mean it is an innocuous virus. And we know there are certain groups that really do have an increased risk of severe disease, the most important being elderly people and people with underlying diseases like heart disease, lung disease, people living with HIV. And these people who might, if they catch COVID, even if they've had a previous infection and could go on to severe disease, really, they should make sure, absolutely sure, that they've had a vaccine or their booster dose if they're up for it. And also, if they want to, they could wear masks or, go to fewer gatherings, because we know there's a lot of COVID around. And to remember that vaccination is available to everyone, and COVID, anyone can get very, very sick from COVID. And so everybody out there should really make sure to get their COVID vaccine or their booster shot, because there is a lot of COVID around, and we know that just because the hospitals are full doesn't mean on an individual basis that you're not at risk of getting a more severe illness.
Prof, I'd like to just touch on that point that you're making of the testing. So given that the people are not coming out in their numbers to test anymore, even when displaying signs of, COVID symptoms, is the increase then that we are seeing on the ground a true reflection in terms of what is happening?
Yes, so you're right. I think it does affect our surveillance. One of the more reliable surveillance programs that we have, so we have our national surveillance, which is what we did for COVID, where we count every single test of COVID done throughout the country at the NICD. And as I mentioned, one indicator of all of the indicators, the one that is perhaps the most reliable in terms of not being affected by how many people test, is the percent positive, and that's going up, and it has been going up week on week. Another Another one that's quite reliable, in fact, is our sentinel surveillance. So we have a number of hospitals in different provinces of South Africa where we have nurses who systematically test everybody who comes in for COVID. This is what we use for flu and other respiratory diseases, because we know there can be a problem with the testing giving unreliable results. And those data also suggest that the COVID cases are going up. There are other indicators such as the wastewater surveillance, which looks at the levels of virus in the wastewater, that suggests it's going up. So I think everything points to the fact that there is an increase in transmission in the community. There's more COVID going around. But as I've mentioned, that doesn't necessarily translate into the hospitals being full. And so there is COVID around, but it's not a cause for panic or alarm, really just to take reasonable precautions. And really the only thing that you should do is have your vaccine if you haven't had your vaccine. Unless you're in one of those risk conditions where you should have the vaccine, and potentially if you're worried, you could consider personal protective measures like a mask, or perhaps not going to very crowded gatherings in enclosed spaces.
I'm glad you mentioned vaccine, because I was going to touch on how do South Africans protect themselves further. Well, it would seem that vaccination is the key. Prof, that's all the time we have this afternoon. Thank you so much for coming out and speaking to us. Of course, that was Professor Cheryl Cohen, and she is the head of the Center for Respiratory Diseases and Meningitis at the National Institute for Communicable Diseases.